Started. Thank you everybody for joining us for our virtual news conference this Monday morning. The topics that we're going to cover today are we're going to have an update for the cases over the weekend. We're going to have some more information and tips for the public and food safety information during this time, and COVID-19 in our local nursing homes, and then we're going to have a media Q&A session like always, but we're doing it a little different this time. We are going to allow the media a question and a follow-up question, and we drew in no specific order the media questioning, and here is the media questioning if y'all did not receive that. Number one will be Fox 34, Daily Toreador, KLBK, KCBD, KMAC, the Avalanche Journal, Texas Tech University Public Media, and Latino Lubbock. And we will get to those after our speakers, but first, let's go to Director of Public Health, Catherine Wells.
Good morning. The Lubbock Health Department hopes that you and your family had a safe and healthy Easter holiday. I appreciate the opportunity to brief our residents on the most recent COVID-19 case results. The overarching message from the City of Lubbock and the Health Department to our citizens is to stay the course. Yesterday, Lubbock had the largest spike in daily reported coronavirus cases, and this included 2 additional deaths. I am sorry to report this news. Yesterday's spike in reported COVID-19 cases reinforces the need for all Lubbock citizens to stay the course and to follow procedures that will help prevent the spread of the virus. We are all familiar with what we need to do, but allow me to reiterate the basics. Wash your hands often. Stay at home unless you have an essential need to leave the house. Practice social distancing, and many citizens have begun wearing a facial covering over their nose and mouth and when they go out into public. And this practice is now being encouraged by for everyone. Again, our message this morning is to stay the course. It's been 27 days since the first reported COVID-19 case in Lubbock. The changes that have been implemented on the federal, state, and local level may be a burden, but they serve a purpose. Everyone needs to be safe. At this time, please allow me to update you on our current COVID-19 statistics and the outbreaks at our nursing homes and long-term care facilities. Through Sunday, the Health Department is reporting 307 positive COVID-19 residents in Lubbock County. We now have more testing. This testing is available in multiple settings. UMC and Covenant are both offering drive-through clinics. We're now seeing testing through our primary care offices, emergency departments, more testing at our public health laboratory, and then the Health Department is out screening at facilities associated with different outbreaks. The city posts dashboard statistics on several social media platforms, and the media has also been helpful in sharing current local COVID-19 information. More people are now listed within the recovered category, and to be listed in the recovered category, the following must occur. The following things occur. The Health Department contacts the individual who has tested positive for coronavirus. We evaluate them, and when their symptoms are clear, we release them from their required isolation. The evaluation and eventual release of these individuals has allowed some workers, especially our essential workers, to return to the workforce. Currently, there are 72 individuals who are considered fully recovered. The good news is also that all individuals who were reported in the first 5 days of our outbreak are now recovered, and they've all been released to go back to their jobs if they have an essential position. The Health Department also reports individuals who sadly have died from this virus. So far, the youngest individual to pass away from COVID-19 in our community was only in their 50s. We've seen 3 individuals who have passed in their 60s, another 3 in their 70s, and 9 of these individuals were over 80 years of age. The majority of deaths are elderly, which brings up the topic of nursing homes. The nursing home outbreaks in our community are deeply concerning. Residents in nursing homes live in close quarters, which makes social distancing difficult. Nursing home residents depend upon multiple caregivers, and this also increases their risk of exposure. These increased risks are why guidelines prohibiting residents and non-essential providers from entering these facilities have been put in place. If the virus becomes established in a facility, it is very difficult to control it. As of Sunday, April 12th, there were 85 individuals with COVID-19 who are currently residing in a long-term care facility or an assisted living facility. In addition to these 85 individuals, there are another 60 individuals who work in these facilities and were likely exposed to the virus while at work. We need to pay attention to this population for many reasons. Residents of nursing homes are the most vulnerable. Studies show that the older you are, the higher the hospitalization and fatality rate is from COVID-19. The virus can spread quickly, which can lead to death. Residents who are infected are also taking longer to recover. Many nursing home workers have recovered, but the residents are taking longer and still remain at risk. We also have to consider our nursing home workers. They can bring the virus home to their families, which introduces more pockets of the virus in the community. Despite this reality, we need to do all we can to support these frontline workers. With this in mind, the health department's goal continues to be identifying new cases associated with nursing homes quickly and to ensure that those who are infected are isolated. We have 20 individuals conducting contact tracing and investigations at the health department, and we are working to add additional contact tracers to the department this week. We are also asking that the nursing home facilities who have COVID-19 to follow all of the guidelines for infection control. We want them to implement sick leave policies for staff that are flexible and that would allow ill healthcare personnel to stay home. We're also restricting care providers from working in more than one facility. The department is working to continue to increase the amount of data we are releasing. The next release of information will occur this afternoon before 6 o'clock. And at that time, we will release the number of new reported COVID cases to the health department, in addition to any new recoveries and any deaths. I will now turn this over to Dr. Cook, our health authority.
Thank you, Catherine. Good morning, everybody. You know, overall, the community is doing pretty well as far as our social distancing is concerned. There's always room for improvement. How do we know that we're doing pretty well? There's actually a number that we look at, and it's called the doubling rate. The doubling rate is actually the number of days it takes to double the number of positives in any given time period. And we average that over about 6 days. Right now, Lubbock's doubling rate is about 3.5 days. That's pretty good, not great. We could certainly improve it, but it's not terrible. Our doubling rate in our nursing homes, however, is 3, but in the rest of the community, it's about 4.5. So our average for the whole community is about 3.5. How does that compare to other places? So if we look at the US in total, the average doubling rate is about 9 days. So why aren't we there yet? Well, part of it is the East Coast and the West Coast are on the backside of their peaks. At least that's what we hope. And so their numbers are getting better. And they're also, if we look at New York City had their first positive case on March the 1st. Lubbock had their first positive case on March the 17th. So we're about 2.5 weeks behind New York City. Hopefully soon we can get past this curve, but we'll see. That depends on everybody that lives in Lubbock. That depends on everybody maintaining their status quo as far as social distancing is concerned, making sure that you continue to wash your hands, that you wear a mask in public, that if you're ill, stay home, don't go to work, and if you're ill, please get tested. I want to say that again. If you're ill, please get tested. Don't let money be a deterrence from you getting tested. We think we can help you out with that. So please get tested if you think that you're sick, and don't go to work. One of the other things that has popped up on social media is how do we count deaths? Well, most of our deaths, as Catherine mentioned, is in the nursing home or those individuals that live in long-term assisted care facilities. But me as a physician, whenever I fill out a death certificate, it goes into great detail of the number 1 cause of death and the number 2 cause that contributed to number 1 and the number 3 cause that contributed to the first 2. That includes if you're pregnant, that includes if you're elderly, that includes if you're a smoker. All of those questions are asked on the death certificate. So the state Bureau of Vital Statistics keeps up with is going to be able to determine how many deaths we actually truly had related to COVID-19. You know, the other information, we don't give out a lot of detail about the deaths. That's a very private and personal affair. And we need to allow those family members that have lost a loved one to make sure that they have time to grieve and mourn and take care of the things that they need to take care of whenever they lose a loved one. You would want the same for yourself. I would want the same for me. So let's give them the honesty and the grace to take care of their business and not ask a bunch of questions about that. The last thing that I want to cover is one of the things that I've noticed and other healthcare providers have noticed is our emergency rooms are amazingly quiet and our clinics are amazingly quiet. This is a good thing, I think, because we've asked you to stay away and not come unless you're really sick. However, what we're concerned about as a healthcare provider is that those of you that have lung disease or heart disease or diabetes or other issues that need chronic management, that need to pay attention to those diseases, please reach out and talk to your healthcare provider. We're going to do the same. We're going to do our best to try to reach out to you too. And you reach out to us. Let's make it a two-way street. We have ways to communicate either telephonically, over the telephone, or by an iPad or an iPhone or an Android. We have ways to keep in touch with you. So let's make sure that we stay in touch, that your disease, that your blood pressure doesn't get out of control, that your lung problems don't get out of control, and that your diabetes doesn't get out of control because you're afraid to come in. Let's reach out and touch each other and make sure electronically to make sure that you stay healthy. I want you to have a blessed day. And if you're ill, please stay home. Mayor Pope, it's up to you. Thank you.
Thank you, Dr. Cook. Good morning, everyone. I want to start with a thank you. I want to thank you for staying home and staying safe. We're getting better at this. It's evident by the feedback I get and the little bit of time I spend driving around. Thank you for doing Easter differently, for worshiping differently, for celebrating differently, for doing your family events differently. I just really appreciate your willingness to modify what those traditions that are so important to us. Now, today's theme has been nursing home, long-term care, assisted living, and I want to add a little more flavor to what both Catherine and Dr. Cook have mentioned. In Lubbock County, we have more than 70 of these type facilities, 4,000 beds in those 70 facilities. And as we've talked about, these are our most vulnerable parts of our population. In fact, I think all but one of our deaths that we attribute to COVID-19 can be related to these facilities. But we can't build a wall around them. It's not that simple. Remember that we have 3,500 people in Lubbock County that work in these facilities. So when you think 3,500 workers, 4,000 residents, that's about 2.5% of our county that is involved in these facilities, and these workers come home to their families. They have to go to meet their needs for essential services, just like you and I do. And so it's a very difficult chore keeping them safe and their families safe, and effectively us safe. As a community, we value the sanctity of human life, every life. The people, our neighbors that are in our nursing homes are our parents and our grandparents. They're often the most valuable members of our families. We need to do all we can to keep them safe. I want to talk about testing for just a minute and remind you that we're very fortunate in Lubbock to have a number of different places that you can get tested for COVID-19. In fact, in Lubbock County, we've tested twice as many per capita, per person, as the rest of the state has. And then when we do our testing, we know that about just under 10% of those tests are actually confirmed cases. That's also a little lower than the state average. Now, testing will become important, even more important, as we start to talk about recovery. And Thursday, we're going to talk more about community spread of this virus and try to talk, and Dr. Cook talked about our doubling rate. We're going to start identifying those metrics that we'll be looking at as we begin to talk about restarting our economy. You may have seen that Governor Abbott is doing a press conference right now, but he announced yesterday that he was going to start announcing a small business task force. And we look forward to seeing what he has to do. We will be talking at our city council meeting tomorrow about what does restarting our economy look like. Now, I believe it'll be a stair-step approach. Stores will be very different. We've already asked our essential businesses to take a lot of steps, and our non-essential businesses will do the very same things. I believe that we can come up with a sensible reopening strategy. West Texans are reasonable, community-minded people. We understand how important small businesses, those family businesses are. And that's why there's so much, I think, urgency to get started again. We've got to be good neighbors. We've got to make certain that we restart in a responsible manner. That's critical for recovery. A friend of mine yesterday, when we were talking, was encouraging me, I believe, and he said, we can see the light at the end of the tunnel, but we must remember that we're still in the tunnel. Let's remain patient. Let's remain diligent. Let's not forget the big three. Let's wash our hands. Let's not touch our face, and let's keep our physical social distance. Thank you very much. Now, our city employees are working very hard during this crisis that we're in. And over the next several press conferences, we're going to bring a number of them to you to tell you what we're doing to provide for your safety. We thought that it might make best sense for our first one of these to have our the gentleman who runs our environmental health and food safety group spend some time sharing with you what his team is doing. So please pay attention to what Stephen Walker has to say. Mr. Walker?
Thank you, Mayor. Our inspectors, they're out in the field. They're doing what they always do. Inspections are a little different these days. These are some hands-on type people that are working, trying to do this kind of hands-off. We're working with the health department and with the fire marshal's office on different issues and things that come up. The inspectors were in some of the Stripe stores this past week. Those were closed and sanitized and reopened. One of those was reopened, the first one, reopened at 5 o'clock in the morning. The inspector was there. The other one reopened at 4 o'clock that afternoon. The inspector was there. And our third one opened the following morning at 5 a.m. The inspector was present when those stores were being cleaned and when those stores were reopened. And want to reiterate, if you're sick, don't go to work. Go home, call your healthcare provider, get tested, follow our CDC guidelines. Some things we have for our food facilities, and they've done a great job of working through this event. But all employees and staff in the facilities, they need to wash their hands. I know hand washing has been preached over and over and over again, but that's what we have to do. We have to wash our hands correctly. We want to use water that's 100 degrees with soap. We want to do that for 20 seconds. Sing happy birthday to yourself twice. When you're done with your hand wash, dry those hands off with a clean, disposable paper towel. Use that paper towel to shut off the faucets on your hand sink. If you touch those faucets with your bare hands, you've recontaminated them. You'll need to go back and do that process again. Practice our social distancing as best as we can. Remember when to wash your hands before putting on gloves. Anytime you switch tasks, if you're working with raw foods, going to ready-to-eat foods, we need to wash our hands. Don't touch ready-to-eat foods with bare hands. Always use gloves. Wash your hands after using the restroom and eating. If you cough, sneeze, touch your face, your mouth, your nose, stop what you're doing and wash your hands. If you coughed or sneezed while you were working with food, we need to throw that item away and sanitize whatever areas were affected by that. Contact surfaces or non-food contact surfaces, clean both of those regularly. Make sure that the sanitizers that you're using are mixed properly. Use test strips to ensure that we've got the right amount of sanitizer. Use those wiping cloths to wipe down your mops and your brooms, your other cleaning utensils before and after you use them, and store those properly. Don't forget about your handles on your walk-in freezers and coolers, the doors and lids on your hot hold, cold hold prep tables. Those all need to be sanitized. Your cutting boards, those need to be sanitized between uses. If you're working a drive-through, taking payments, handing out food, wash your hands or use a hand sanitizer between customers. Remember, everything needs to be wrapped. We don't need to be handing out food that's not unwrapped. If you're delivering food, it should be wrapped for transport. Your coolers, transport containers should be cleaned and sanitized between uses. Encourage no-touch distancing, or no-touch delivery, excuse me. If you have curbside service, practice social distancing. Offer to place the order in the trunk if you can. Let's not forget about our other food safety issues to prevent foodborne illness. Make sure we're checking our temperatures, our hot hold, cold hold temperatures, our cooking temperatures. Make sure you're doing your date marking correctly, rotating your stock in and out correctly. Prevent cross-contamination issues. If you do have something that's cross-contaminated, let's make sure we get that discarded. And I'll turn it back to Lacey.
And now we're going to open it up for media questions. First, we have Tori McGee, Fox 34. Just a second. Tori? Tori, can you hear? Can you unmute yourself, please? Okay, we'll come back to her because it's not unmuting. Okay, how about Adon from the Daily Toreador? Adon?
Can you hear me? Hello?
Hello?
Okay. Hello, everyone. For my question, obviously what's going on, Governor Abbott is implementing a small business initiative to possibly reopen certain businesses. So I was wondering, are there any discussions on how certain precautions or requirements would be implemented to allow certain businesses to be reopened?
I'll take that one, I guess. We certainly, first of all, thank you for your question. We'll certainly pay close attention to what the governor's Small Business Task Force works on. I think we'll be doing the very same thing here. Certainly there will be precautions taken, steps that will have to be put in place prior to a reopening, and I think that would be for any of our businesses.
Don, do you have a follow-up question?
No, that'll be all. Thank you.
I'm gonna go back to Tori real quick. Tori?
All right, can you hear me now?
Yes.
Gotcha.
Okay. So there's been a lot of feedback from small business owners. I think it was mentioned, Mayor, you talked about a sensible reopening strategy. Do you see a clear-cut point where you can say, yes, everything will reopen up?
No, I certainly don't see that yet. I think we'll have to, as you and I talked on Friday, there's a number of factors that go into this. One of the big factors is the infection rate, the confirmed case rate, the number of new cases. There'll be a number of metrics we'll look at from the health side of things before we get started. But we certainly will be beginning that. We have begun that work, and we'll announce this week formally how we're going to do that locally. But we're going to we're going to stay the course right now, Tori. We reported 37 new cases yesterday. It's not responsible to reopen right now. And I think the governor's order and our order are consistent in that regard.
Going to Terry Furman with KLBK.
Good morning, everyone.
Morning, Terry.
All right, viewers have been asking us a lot, online, phone calls, about positive tests at the Montford prison. Can you give us any number of any inmates or guards at prisons or jails in Lubbock County?
I'll go ahead and take that one. The testing within the Texas TDCJ, the Texas Criminal Justice System, is handled by their system, and I have not been notified of any positives from that unit.
Okay, very good. Thank you.
Okay, next we have Karen McKay.
Good morning. This would be either for the mayor or Dr. Cook. I think people are really looking for some sort of a goal, a number that we can look for. And you, for the first time, mentioned this doubling rate, and maybe that 9 was a number that was used on the East Coast where things started to get a little bit better. Does that mean that we can look at, you said right now we're 3.5 days, but when we reach 9 days for a doubling rate, is that something we can look forward to as when things might start to ease off and become easier as far as businesses opening and becoming more normal again?
Yeah. Hi, Karen. This is Dr. Cook. It's very difficult. I don't want to put a specific number to shoot for. I don't think we can go for that. Even at 9, where New York City is, I don't know that they are opening businesses. I haven't paid that much attention to their small business initiatives there, but we've got to get significantly better than where we are before we can say that we'll probably open businesses. I'll ask the mayor to interject here as well too.
I think you.
And I also want to ask you.
I think you
go ahead,
handled it
Mayor.
very well, Dr. Cook.
I also wanted to ask either who would like to answer this about people who have recovered so far. A lot of people, as you've said many times, Mayor, the vast majority recover at home. So if they're recovering at home, how can you measure these people to be able to make sure that they come in for those negative tests and you know that they're okay now to get the okay to go back out in public? What are you doing to help prevent people from just saying, I feel better and going out in public? So,
Karen, I'll answer that question too. So we say stay at home for 14 days. And, hopefully we don't have enough tests to test everybody that's negative, at least not yet. Hopefully that's coming soon. But right now we're saying 14 days, and at least a week of that, you must have improved your symptoms by at least 50% and no fever for 72 hours or no fever for 3 days. That's sort of the magic number. 14 days, 7 days of significantly improved symptoms with no fever in the last 3 days prior to returning to work. We just don't have enough tests to prove that that you can return, to show that you're absolutely negative.
And we have Matthew Stell with KMAC.
Hey, good morning, everybody. This question, thanks, Lacey. First question is for Mayor Pope. Mayor, we know that the stay-at-home order was extended to April 30th. Is the City Council planning on reconsidering that, possibly extending that? Will it be lifted on the 30th? What's the status on that right now?
Well, first and foremost, we're under the same orders as the governor's put the state. So we're together under that order until April 30th. The City Council will not consider lifting that. It would go in conflict with that order. So we will certainly look closely at what happens after April 30th. As you know, we have a council meeting scheduled for tomorrow. We will be discussing this in some depth at our council meeting, and I look forward to that discussion. But let me clarify or re-emphasize, there's not a plan to lift our order. We, for the reasons that I stated earlier, we've got to make certain that we stay safe for this next 17, 18 days so we can begin to restart. There's likely to be some metrics that the state is going to ask us to meet, as Dr. Cook has started to allude to. There's likely to be some metrics that we're going to have to meet before we can restart. And I think that's why it's so incumbent upon us to take this stay home, stay safe situation we're in very seriously.
I've got a follow-up, Lacey, real quick. This question is for Catherine Wells. Ms. Wells, the last thing we heard was that at least 12 deaths were associated with nursing homes, but that's the last number we've heard. We know the death toll is now 16. Has that number went up as it relates to nursing homes? Because that's the last heard was 12.
Yes, over the weekend, unfortunately, we had to announce some additional deaths. 15 of the 16 deaths reported in Lubbock have some association with a nursing home or long-term care facility.
Okay.
Next we have Matt Dotre from the Avalanche Journal.
Everyone, more questions about the nursing home, Ms. Wells. So I'm assuming every resident of these 4 nursing homes is being tested. Can you talk about what percentage of residents have tested positive, and then maybe when that testing will be completed?
I don't have exact percentages of how many have tested positive. We're seeing different numbers in different nursing homes. Today we're going out and doing another 50 tests for individuals in nursing homes. I believe we've gotten everybody tested at the Whisperwood facility, and we're currently working with other facilities. Our goal, right, and some of the guidance that's come out in the last 2 or 3 weeks is really, if you have one positive case, you want to go in there and test as many people as possible. Some residents are easier to test than others, but we're working with those facilities to get as many tested as possible.
Okay, and then a follow-up to that, can you talk about what the sick policy was, and maybe a bit about how you believe that impacted things?
I don't know what the sick policies were in the new guidance that was released by Texas Health and Human Services. It's asking facilities to loosen up those sick leave policies and make sure that they are not requiring sick individuals to come into work, or making sure that they're doing appropriate screening. That's something that's been announced throughout the state of Texas. That's not something specific for Lubbock.
Okay. Our next question in order was a representative from Texas Tech University Public Media, but I don't see you here. So would you please raise your hand and I will get to you. So we'll go on to Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. I'm Christy with Latino Lubbock Magazine, and mine has to do more with demographics. I know nationally and internationally, more men have been affected by COVID-19, but in Lubbock, more women have been infected. Why do you think that that is? Is this community-based, or, I mean, why are more women being infected with COVID-19 than men here?
Christy, this is Dr. Cook. I don't have a good reason for that. You know, I've noticed that too. If you look at our graph, we have more women that have been tested positive than men. And like you said, nationally, more men are affected. I don't have a good reason for that. I don't know if it just the people that have been tested have just been more likely to be women. I don't have a reason for that at all. I wish I did. That's a curious finding though.
And in talking about demographics, nationally, we've seen a lot of Black and Latino individuals being affected by COVID-19. There's many, many reasons. Here in Lubbock, what have the demographics been as far as those folks that have been infected? And do you think that that has anything to do with cultural competency or lack thereof from those that are administering that information, test-wise, whatnot?
I'll take that one quickly. Christy, the original test paperwork that was being submitted to the health department did not include any race or ethnicity information. We're currently working to backtrack and actually have that information ready for release, but there's going to be a delay because it requires staff going back and reviewing medical records at this time.
All of our questions. I want to thank all of our panelists today and thank you all for joining us. Our next press conference will be Thursday morning at 11:30 and we'll have updates on cases between now and then and more on the community spread cases within Lubbock. And I'll be updating the information later today around the usual time. Thank you all for joining us.